Hello friends, hope everyone is happy and healthy. Today we are going to discuss about the immunological drug reactions of the skin. Right? This is the dermatology topic or the pharmacology topic. You can decide whatever you want. First of all, the mechanisms involved. Among them, the first one, IgE mediated immunological response. This causes urticaria and the anaphylaxis. These lesions that you are seeing are the urticarial lesions. You can call it as urticaria. The second one is cytotoxic reactions. Here the example is that the petechiae that are secondary to the drug induced thrombocytopenia. This is an example. I will explain you a little bit about this. If you ever heard the word HIT, that is heparin induced thrombocytopenia, what happens is that for heparin our body will be producing some antibodies. Some persons will produce antibodies. These antibodies will react on the heparin, which will be present or deposited on the platelet. So this deposition of the antibodies on the platelet will cause the destruction of the platelet. When there is destruction of the platelet, the total number of platelets will going to be reduced, causing the thrombocytopenia. What happens? Then there will be formation of the petechiae. So these are called secondary to petechiae that are secondary to the drug-induced thrombocytopenia. And the third one, that is immune complex mediated, that causes vasculitis. The immune complexes, that is antigen antibody complexes, these will deposit in the blood vessels. While traveling through the blood vessel, they will get deposited on the walls, causing the inflammation. So that we are calling it as vasculitis. And the fourth one, that is cell mediated, and for that the example is that contact dermatitis. As you are seeing, all these are lesions that are contact dermatitis lesions. Okay, if you observe it closely, these are all looking like hypersensitivity reactions. Just correlate everything. Type 3 involves immune complex, type 1 involves IgE antibody. Are they really? Of course, they are all hypersensitivity reactions. Any drug that enters our body might cause immunological reactions, immunological hypersensitivity reactions. So there are 4 type of hypersensitivity reaction, and all these are the example of that. And what are the characteristics of the immunological responses of the drug? Okay, the first one, these are less predictable. You can't predict to the patient whether it's going to happen or not, and are not the normal pharmacological effects of the drug. So usually the drug doesn't cause this, the immunological response to the drug will cause this. Okay, and it involves the previous exposure of the drug or any chemically related compound, and it can occur only in a minority of the patients who receive the drug, and it can also develop with the low doses of the drug. What our body needs is just to know whether the drug is there or not. Once if it knows that there is drug, it is going to react, and it appear after a latent period because it involves immunity. It needs a time to react, so it may be from few seconds to few days. For example, few seconds, that is type 1 or IgE mediated. Type 4 for few days, that is cell mediated immunity. Okay, this is everything about the hypersensitivity reaction, right? So we are giving it as another name. It is absolutely not required. Anyways, this was about the today's topic. If you have any doubt, please drop down them in the comment box, or else just like and subscribe.